am proud to share Grandview Kids' 2025 to 2026 annual report, part of our Powering Potential strategic plan. A roadmap that continues to guide how we evolve, how we care, and how we create lasting impact for children, youth, and families across Durham Region. Guided by this plan, we have sharpened our focus in three key areas: improving meaningful outcomes for clients and caregivers, building a thriving and empowered Team Grandview, and strengthening our impact through trusted local partnerships. This past year, those priorities translated into real, measurable progress. Together, we delivered more than 166,000 hours of care across nearly 95,000 visits, supporting over 10,000 children, youth, and families in our community. Behind every number is a story of a child reaching a milestone, a family finding support, or a team member going above and beyond to make a difference. That's what Powering Potential looks like in action. Improving access to care remained a major focus. We reduced wait times for medical services by 10%, enabling children to see our developmental pediatricians sooner and receive vital assessments, diagnoses, and early interventions when timing matters most. We also strengthened our commitment to authentic partnership with clients and families. This year, we launched a sector-leading initiative that cross-appointed board members with lived experience to our Family Advisory Council. This forward-thinking initiative creates stronger alignment between these groups and ensures family perspectives help shape governance decisions. We remain committed to elevating Grandview Kids' nationally recognized family engagement model, both internally and alongside our partners. Team Grandview's excellence was also recognized by Accreditation Canada, earning accreditation with exemplary standing, the highest possible designation. To put this into context, Grandview Kids was evaluated on hundreds of criteria, including 77 required organizational practices, ROPs, meeting every single one. Through on-site reviews to interviews, observations, documentation, and a detailed assessment against hundreds of criteria, Team Grandview truly went above and beyond to demonstrate how deeply committed Grandview Kids is to excellence in pediatric rehabilitation. We also prioritize the development and use of evidence-informed practices to improve service quality and build on our clinical expertise. This included important progress in both the study and implementation of anti-racism and culturally safer care.
Ontario Tech is proud to continue partnering with Grandview Kids to advance research and evidence-based practice in pediatric rehabilitation. This past year, with the support of a SHIRK Partnership Development Grant, we finished phase 1 of our study known as the IDEA study. I was one of the principal investigators alongside Dr. Taryn Eckmeyer from Grandview Kids. The IDEA study sought to better understand the barriers, biases, and inequities faced by children and youth with developmental concerns when they are waiting for and accessing pediatric rehabilitation. The findings are intended to support Team Grandview in delivering culturally safe care. This study is important to create more equitable, inclusive, diverse, and accessible services and reduce barriers that racialized parents and caregivers experience. We look forward to working with Grandview Kids to mobilize this knowledge to improve experiences, expectations, and outcomes for racialized families in the Durham region and beyond.
On April 2nd and 3rd, 2025, we hosted our first ever series of Clinical Excellence Days. The three of us were proud to support planning of this inaugural event.
We invited over 50 researchers and clinicians to share work, exchange ideas, and encourage the adoption of promising practices.
This kind of information sharing strengthens the care that we provide today and sets the standards for tomorrow.
Our Clinical Excellence Days support our ongoing strategic commitment to fostering a thriving, connected Team Grandview and our goal to leverage and strengthen Team Grandview's expertise in researching, adopting, and evaluating leading practices within our strategic plan. Being part of the planning helped me to recognize and appreciate the knowledge of my colleagues. It was rewarding to co-create a space where different perspectives and areas of expertise could come together in a meaningful way.
It was an honor to help inspire an event where our collective passion and knowledge could be seen, shared, and celebrated. This contributes to building a culture that prioritizes professional growth, reflection, and excellence. Highlights from the event included learning ways to enhance our practices, hearing about research being done at Grandview Kids and how it's benefiting our sector, and brainstorming together on ways to improve services for all Grandview families.
The event also helped set the stage for continuing to build practical and supportive professional learning experiences for Team Grandview. Opportunities like this help us to connect across disciplines and strengthen working relationships, especially for our teammates working in the community or at satellite locations. This deepened our connection to the work we do every day at Grandview Kids.
We look forward to future opportunities to learn from and learn with one another.
Team Grandview also partners with other providers to improve our services and clinical practice. This year, Grandview partnered with the Lakeridge Health and the Lakeridge Health Foundation in the development of the Grandview Anesthesia Procedure Clinic, otherwise known as the GAP Clinic. The GAP Clinic is the first of its kind in Canada, made possible through this pioneering partnership. The GAP Clinic supports children and youth receiving Botox injections to treat spasticity or dystonia caused by conditions such as cerebral palsy. Many clients require multiple injections during a single visit, causing stress, pain, and anxiety. Anesthesia reduces discomfort during this medical procedure. Getting the GAP Clinic into operation was a collective effort made possible through the generous support of our Durham region community. Much needed equipment was purchased with donor-raised funds from the Lakeridge Health Foundation's successful $1 million campaign. Together, we are delivering enhanced community-based care for our Grandview clients and families. But why take it from me? Let's see what one of our clients has to say.
Hi, my name is Wes and I'm 10 years old. I've been getting Botox shots in my legs for a very long time. I know it's important to get them because they help me move easier, but they also hurt a lot and make me nervous.
Wes has needed up to 16 Botox injections in his legs without sedation every 4 to 6 months since he was 4 years old. These treatments are essential for managing his pain and supporting his independence. But each visit is difficult, heightening his anxiety and fear. As a parent, it's heartbreaking to watch him cry and struggle through every procedure. The only alternative has been hospital sedation, but for a medically complex child with a long history of hospitalizations, that environment only deepened his white coat anxiety. It offers a safer, more compassionate option that prioritizes children's comfort.
The Grandview Kids Development Department has been busy all year fundraising and building relationships with donors, partners, volunteer, and staff in order to foster a culture of philanthropy at Grandview Kids, one where every member of our community understands their role in advancing our mission. Philanthropy is what turns good intentions into real outcomes. It turns compassion into action. It turns generosity into opportunity. And it turns small moments of giving into lasting change. Thank you to everyone who has supported us along the way, inspiring joy, hope, and new opportunities for clients and their families. Through the contribution of our generous donors, we've been able to enhance Grandview Kids programming, aligned to our 3 funding pillars: the Family Engagement Program, Research and Innovation, and the Family Support Fund. The Jeremiah F. Coughlin Foundation graciously provided seed funding to establish the Family Support Fund, which launched in February 2026. The fund provides short-term, need-based financial assistance to families of clients who are actively receiving services at Grandview Kids. It helps bridge funding gaps for essential specialized equipment not fully covered by other sources. This eases financial pressure on families so they can focus on their child or youth's health, well-being, and inclusion. The Family Support Fund creates opportunities for families like Nora's to better support her in reaching her full potential.
The Family Support Fund helped us get a cube that Nora plays with here at school, so we can have it at home just to help her just kind of relax a little bit. There's a lot of families in interesting situations where their whole life has turned into just providing for their kids in need. And what often happens is there's really no disposable income. So a lot of our income that we work for just goes towards therapeutic services. So it's really just allowed us to have some fun. Thank you so much to everyone who's donated to Nora, to any family that's in receipt of this fund. It means a lot to us, more than you'll ever know.
As we reflect on our progress, we are both proud and motivated. We know there is still more to do to ensure every child, youth, and family can access care when they need it most. That is why we will keep innovating solutions, removing barriers, and building on our successes to further improve experiences and outcomes for clients and families. We will continue to pursue promising clinical practices and ensure Team Grandview has the tools, resources, and training needed to thrive. And we will deepen collaboration with both new and existing partners to enhance programming and strengthen connections across the system. What makes Grandview Kids truly special is our community, our dedicated teams, our partners, and the families who place their trust in us. It is through this shared commitment that we create meaningful impact and brighter futures. That is something we're celebrating. So thank you for your continued support, partnership, and belief in what we are building at Grandview Kids. When we work together, we are not just planning for the future, we are powering it.